So today we'll be talking about oral food challenges. It's a diagnostic procedure usually we do in the diagnosis of food allergies very commonly. It is either to refute or to confirm a diagnosis of food allergy of a suspected food allergen. Many times, the patient would believe that they have perceived food allergies. I eat that, I get some reactions, so I'm not okay with it, and they tend to avoid a lot of foods, which has a bearing on their nutritional impact on their health. So that is one of the main indications where oral food challenge is indicated. Otherwise, when we suspect a food allergen, but on the skin prick test or on the blood test, we may not be having a positive result. But when the clinical suspicion is high, it is the diagnostic to go procedure to confirm the diagnosis of food allergies. So, what are the possible indications? We do in IgE mediated immediate reactions, such as when the patient has had hives, urticaria, angioedema, wheezing, or abdominal symptoms, sometimes even severe life-threatening reactions like anaphylaxis. So in that patient, we definitely do oral food challenge when the clinical suspicion is very high. But in anaphylaxis patients, we may schedule a food challenge a few weeks later, 6 to 8 weeks later, after the index reaction. Or in non-Ig mediated reactions such as food protein induced enterocolitis syndrome. Because it's a non-Ig mediated, we may not have supporting clinical laboratory evidence for the same. So here, whether the patient has outgrown, especially in children, whether they have outgrown food allergies, and to include them back in the diet is when we actually schedule an oral food challenge. What are the factors we have to consider when we are actually scheduling an oral food challenge? The nutritional impact of the food which is being avoided or we are trying to include back in the diet. Because of the perceived food allergies, if there is a lot of restriction on the diet, especially in the children, we feel that the child must be introduced that food back into the diet. Sometimes it's not just as clinicians what we want. We must also take into consideration what the patient and the family want. It's easier just to do an oral food challenge, and if the patient has passed, we tell them include in your diet, but it is useless if they're not going to include in their diet regularly. So that is one factor we must take into consideration, what the patient, attender and the family wants. And the risk of a reaction, this is very high. So it's about 50% chances of a reaction we do anticipate. If it is less, around 50%, then probably worthwhile going for an oral food challenge. We should educate the parents and the patient, be it a child or an adult, the possibility of a reaction, like what they can feel. It could be the starting of a wheezing episode if they are prone for asthma, or sneezing bouts if they are patients of allergic rhinitis, or they may have hives, just vague abdominal discomfort. So they must anticipate, they must know what they should anticipate. Actually, how much inclusive the food is going to be in their day-to-day life. Is that a part of their regular routine? That also must be taken into consideration. So, we should discuss them in advance. What are the steps we are including? If I anticipate the food challenge to be negative, that means they're going to pass the challenge. They're not going to have any reactions when they eat that particular food. Probably I would be scheduling the procedure in about 2 to 3 steps, incremental doses. We start with small amounts and go up to larger amounts, and with intermittent monitoring in between, and all the emergency medications being on standby. If we anticipate the risk of reaction being high, probably it is cut down into a little more steps, maybe around 4 to 5 steps at interval anywhere between 5 to 30 minutes between each step. On preparing the patient, so usually once we schedule, it would be scheduled about few weeks later, 2 to 4 weeks later, just to give the patient time to omit the suspected food allergens or whatever we are challenging in the oral food challenge, being it milk, egg, peanuts or wheat, any other food. They must stop from their diet if they are taking it also at least 2 to 4 weeks before the challenge. And our staff called them back the previous day to confirm the appointment. The list of medications they are expected to stop, like antihistamines, at least 3 to 5 days before we schedule an oral food challenge. Make sure the child or the patient is not on any antihistamines a few days prior to the challenge. They are continuing to take their asthma and allergic rhinitis controller medications like Budocort or any intranasal steroids. They must be off any short-acting bronchodilators at least few hours before the report to us. We tell them to have overnight fasting and report to us early in the morning. Say we start in the first half of the day by 8:30 or 9 o'clock, 9 a.m. The patient must be well on the day of the challenge, that they must be not having any concurrent infections and not on any antibiotics. So usually we ask them to carry some gadgets or books which keep them occupied, because it does take about 2 to 3 hours for the oral food challenge to be completed. And sometimes children do not like the taste of the food we are trying to give them. So we do discuss with the family well in advance in what form they would want to have. If we are doing the challenge in a cooked form, we would ask them to prepare it at home, go through the recipe and try to get the food in what form we have discussed. Any masking agents like applesauce or hummus, chickpea puree. So children like that. So to mask the taste of the food what we are giving, we ask them to get it. And under close monitoring, we do alleviate the fears that the patient has been told that to avoid that particular food all their life, and now we are expecting them to eat. So some amount of anxiety would be there. So on the day, we make sure their vitals are all checked. They're in good condition, good reasonable pink of health, and then we start the procedure. And usually we give a gap of about 15 to 20 minutes before each procedure. And before we start, it is very important to go through the protocol again, take an informed consent from the patient if it's an adult, or from the parent or the guardian in case of pediatric patients. And then we have a monitoring chart based on the patient's weight. We preload the medications like epinephrine or aspirin if required, or antihistamines, so that the staff know what to give medications in case of any allergic reactions at the slightest doubt. So it is all preloaded, and then we start the oral food challenge with intermittent monitoring, and we tell them all of us are around. So if any possibility of a reaction, everything can be taken care of. So post the challenge, if the patient has not reacted, we tell that the patient has passed the challenge or it was a negative oral food challenge. So in case of this, the patient is asked to wait here after the procedure at least for 1 to 2 hours, and then we can let them go. If the patient had any reaction, say it's a positive oral food challenge, and that time we may ask for monitoring for a little more longer time, around 2 to 4 hours. So if the patient has tolerated the food, we would ask them to continue taking the food. If the patient has had a positive oral food challenge, the patient continues to avoid that particular food. On that particular day, once they go back from here, they are discharged from the office. They are asked to keep the physical activities a little low for the next 24 hours because it can aggravate the physical symptoms. We follow them up after giving a phone call 24 hours later just to make sure they are doing well. So this is the procedure of the oral food challenge. Please sit down. So, good morning, Komla. Hegidira? You're doing good? So today, I think we have planned for oral food challenge for egg. I think because you had egg allergies prior, and I think if I remember correctly, when you were young, when you had egg, you used to have rashes, eye swelling, lip swelling. So since many years, you have been avoiding it. And latest, when we have done your blood test, allergy test, and the skin prick test, the risk of possibility of you tolerating egg was a little higher because the allergy component has been on the declining trend. So, as we have discussed earlier, oral food challenge in the baked form, we'll be giving it to you in the form of a cake. Okay. So, I know you've been avoiding this egg for a long time, but you may not like the taste initially. But I'm sure the possibility of you developing any reaction is quite low. So probably we will just do this in 2 to 3 steps, and we start with a very small portion. We wait for about 15-20 minutes, and then after another 20 minutes or so, we'll be constantly monitoring. Then a little higher dose than the first step, and possibly third or fourth step later, we'll total portion would be about close to 1 kg you'll be able to have. Have you stopped all your allergy medicines in the last few 3 to 5 days? You're not prone for asthma, right? You're not prone for asthma, so you're not on any inhalers. Okay. And you do not have any fever or anything in the last few days. I'll just examine you, and anytime during the course of the procedure, if you find that mild, any tingling sensation in the mouth, or you're finding any breathing difficulty or any rashes, if it happens, you have to tell either me or our staff would be around. You have to just intimate them at the slightest doubt. Okay. So don't be afraid. I think it will go well. So if this happens, you'll be able to eat eggs in your diet. Okay. So during the preparation of an oral food challenge, it's important that we have emergency medications on standby, like a loaded adrenaline based on the weight of the patient, an auto injector pen if it is available, it is very good. Any antihistamine syrup or tablet, syrup in case for children and tablets in case for adults. If the patient is prone for any wheezing, it is better to have a inhaler standby for salbutamol if in case they have any respiratory symptoms. So after having the emergency medications on standby, during the course of preparation for oral food challenge, once the patient gets what the food we are actually challenging, in this patient will be challenging for a baked egg a muffin or cake challenge. It's important to have weighing scales, different kinds of weighing scales, because sometimes if we are doing minute quantity, we may use a smaller weighing scale, which may give us to more finer measurement of the weight, or a bigger weighing scale when we are weighing larger scales. Sometimes we do weigh liquids. So for that, we may use syringes to weigh the actual quantity of how much we are giving to the patient. So it is important to have cups, spoons, knives, or measuring cups, containers, because sometimes we may mask the taste of the food in few sauces and mark them 1, 2, 3 different portions, so that we can give at the allotted time, or the staff can monitor and go on to give the next dose if the patient is tolerating the previous dose. So it's important that when on the day of the oral food challenge, make sure we do not have any food challenges where it can cross-contaminate for other patients and cause an allergic reaction for other patients. Like we are challenging somebody who has cashew nut on that day. But if the patient has a peanut allergy, unknowingly if we are challenging any patient for peanuts, we should not be using the same containers for the patient, because it can actually unknowingly cause a reaction to that particular patient. So make sure we use separate set of vessels or utensils or feeding trays for that particular patient. Sometimes we do use microwaves to heat it up, give a little better palatability for the patients. So in Komala's case, we are giving a baked egg muffin challenge. So we are going to weigh, so it is around 68 grams. So the anticipation of this patient having a reaction is very low because her skin prick test is quite negative, and even her immunocap is very low. So the anticipation of having a reaction during this course is very low. So I would be doing this challenge in probably 4 steps, and we would divide it like 1/10 of the dose, then 1/4, 1/2, and remaining portion for the patient. So usually we would make sure we have separate containers. So approximately to the point. So probably around 1/10, approximately 10 to 50, 17 grams it is shown. Probably this will be the first step. And the second portion we would be giving a little more than the first dose. And a little more than the first dose. And I think we would divide the last dose into. So as we go along, we will divide the doses and we put them in separate cup. So this probably this is a little lesser than the second portion, so I may use this as the second step and the remaining as the last step. So in these 4 portions we would be dividing as 1, 2, 3 and 4, and we would label them in case we miss them, and we would label them as in the same order, or we would keep it in the same order what to be given. So this incremental doses we would be giving every 15 to 20 minutes apart, and ask the patient to tell us if she has any shortness of breath, any tingling sensation in the mouth, or any swelling of the lip. And usually we would have a protocol well in place, and so as I said, this we would be having the patient details, the emergency medications already assigned, so that we know what emergency medications to be given. So we are doing baked muffin. So we would be giving 1/4 of the portion, then another 1/4, then 1/2, and full portion. So what time we are giving the medicine also, food will be saying, and what is the result. If there is no reaction, we would say no reaction. 15 minutes later, we would proceed on to the next step. At the end of the challenge, what is the total dose of the food we have given and what is the ultimate result of the patient is what we will be telling. So we are starting with the first step of the oral food challenge. So Komla, as discussed, will be giving a small piece of the baked egg cake for you, so you can have it. So in between the steps, we monitor the patients for any possible allergic reaction. We monitor blood pressure, pulse, oxygen saturation, and we auscultate just to make sure the patient is not having any wheezing. It is actualizing. Fine. Okay. Everything looks fine in formula. So we'll just go with the next step of the food challenge. So we are starting with the second step. So Komla, last 15 minutes after taking the first portion of the egg, we have not had any reactions. So we are going ahead with the next dose of the cake. So you can have this, and we'll monitor you for another 15-20 minutes. And if you have any uncomfortable feeling, you should let us know immediately. Okay. So Komla, you've been fine. So we've checked your vitals such as your pulse, BP, and your oxygen saturation, and you're doing well. So we are going ahead with the third dose of the step. So this is a little more bigger portion than the egg, the egg cake you had it. So kindly have this. And are you feeling okay? Are you feeling any numbness in your throat or anything like that? So this is the final step of the last step of the challenge, Komla.
Okay.
And you can have this. I think you have almost had close to about 3/4 of the cake. So this is the last portion. So kindly have it.
Oh.
So Komla, you have finished all the steps of the egg challenge. And after 1 hour after the last step also, you look fine. Are you feeling okay? Any throat congestion, any breathing difficulty, stomach pain, anything like that? Did you like the taste of the cake? So do you want to continue having it? Yes. So probably because you have tolerated, I think we'll just wait for another 24 hours. In case intermittently, if you have any symptoms, you can reach out to us. Otherwise, we will call you tomorrow. And if there have been no symptoms, you can continue to eat this baked egg in your diet at least 2 to 3 times every week. This until tomorrow morning. Don't have any vigorous physical activity, no alcohol intake. Avoid eating outside food or anything. Just do your routine activities. And I think if you're fine from tomorrow, you can have this baked egg in your diet regularly. Thank you.